The 2022 emergence of monkeypox.
On May 6, 2022, the first case of monkeypox, a zoonotic virus, was identified in the United Kingdom. The individual was a resident of the UK who previously traveled to Nigeria. By May 21st, a total number of 92 cases were counted, spanning across 13 different countries that do not commonly have monkeypox cases. The disease continued spreading to countries where the disease is not endemic and was declared a global health emergency by the World Health Organization. Current research on the disease highlights that patients of monkeypox are primarily found to be men having sex with other men between 20 and 50 years old. In July of this year, the World Health Organization announced monkeypox to be of international concern.
According to statistics published by the WHO in May 2022, countries that showcased the highest rates of prevalence of the disease were as follows: the United Kingdom, Spain, and Portugal, followed by Western European countries and those in North America. Monkeypox is classified as a viral zoonotic infection, a class of diseases that are transmitted between species from animals to humans or vice versa through multiple modes. The monkeypox virus belongs to the Poxviridae ancient virus family, a species of brick-shaped viruses found in insects, reptiles, birds, and mammals. The monkeypox virus takes control of an infected person's ribosomes, which are organelles within human cells that help form proteins in the body, and cause them to produce high levels of infectious monkeypox proteins within that body. As of yet, two known subgroups of monkeypox exist, the West African strain and the Central African strain, yet both originate in Cameroon. PCR testing from the current outbreak indicate that people are being infected with the West African subgroup of the disease. The original source of monkeypox is wild animals, such as squirrels, mangabey monkeys, and Gambian rats. It remains unclear who the primary host is in the transmission of monkeypox, but it is believed that rodents are most often the host reservoir rather than monkeys. The monkeypox virus can be transmitted to humans through contact with infected animals, persons, or materials. An animal bite or scratch, handling wild game, or using infected animal products can lead to contracting the virus. Moreover, human-to-human transmission of the virus happens through contact with large, infected respiratory droplets. The mode of transmission between humans is similar to what is seen with COVID-19, making it evident why it is a major global concern.
The associated symptoms of monkeypox include skin rashes, headache, fever, vomiting, oral ulcers, which are wounds found within the mouth that can further implicate cavities, conjunctivitis, also recognized as inflammation within the eyelid, and tissue swelling, lymphatic hyperplasia. The most recurrent symptom of the virus is lymphatic hyperplasia, which is an identifying factor for disease recognition.
While most patients with monkeypox infection recover without medical treatment, some may require additional care. In particular, if individuals are experiencing symptoms such as vomiting or diarrhea, they may require oral or IV rehydration to replenish the fluid they lost. Additionally, individuals may be prescribed antivirals such as tecovirimat, brincidofovir, cidofovir, and vaccinia immune globulin, or VIG, all of which are drugs that inhibit the development or replication of the virus in the body. Individuals with monkeypox may also require additional supportive care, which may include hemodynamic support, which are treatments to maintain blood pressure, supplemental oxygen, which is when oxygen is given to maintain normal function, or other respiratory support. Also, due to their genetic similarities, the smallpox vaccine is expected to provide some protection against the monkeypox virus. According to the United States CDC, prevention of monkeypox is expected if the vaccine is administered within 4 days of exposure to monkeypox due to the virus's long incubation period. Finally, measures such as contact tracing are typically employed to control the spread of disease by ensuring that those exposed to the disease remained isolated so that they cannot infect more individuals.
Now we will move into a segment that displays the interviews we conducted with two community members on what they feel about monkeypox and how they've seen it be portrayed in social media. So starting off the interviews today, we're going to be having Amrit. Thank you so much for joining us.
Thanks for having me.
So I wanted to start off by asking, have you seen any posts on social media regarding monkeypox?
I saw a post on social media that monkeypox was created because of a COVID-19 vaccination.
Okay, that's interesting. And how do you feel about the rise of another infectious disease?
Because of COVID, it kind of scares me.
Thank you. Moving into our second interview, I'd like to introduce Simran. Thank you so much for joining us here today.
Of course, anytime.
So Simran, I wanted to begin the interview by asking you, have you seen or heard anything on social media regarding monkeypox?
Well, actually, at the beginning of the year, I saw posts on TikTok that monkeypox was actually created in a science facility.
And what did you think about that? What did you take away from that statement? Was it real? Did you think it was fake?
Honestly, I don't think the post was saying the correct information, but I feel there's not enough scientific communication with researchers and the public causing misinformation.
Okay, thank you so much. And what do you feel about the rise of a new infectious disease after COVID?
Seeing what COVID has done to our society, I'm nervous to see the changes that will occur now.
Okay, thank you so much for joining us here today.
Thank you for having me.
The presence of monkeypox has only grown since its first discovery in May of 2022 in the United Kingdom. Spain and Portugal, among other European non-endemic countries, have been hit the hardest by this viral zoonotic infection that has made its way from animals to humans. Monkeypox brings with it a slew of symptoms, ranging from debilitating to moderate, with the most common being lymphatic hyperplasia. Current treatments are limited to oral and intravenous medications, antivirals, supportive care, and the administration of the smallpox vaccine to limit the severity of infection.
Thank you for watching our presentation, and please subscribe to the McMaster Demystifying Medicine channel.